Do I have a deep bite? Do I have an overbite? Do I have an open bite? What is a crossbite?
That needs to be resolved now impacting your teeth health. The moment you have any crossbite, you see it and you correct it right away. They started as a thumb sucker or a put fingers in the mouth or something as a child. The hardest part is to keeping them closed.
They're notorious to open up again.
They are notorious that they will open right back up to you. It's very uncomfortable to live with an underbite.
Awesome, guys. Welcome back. Thank you for joining us for another episode of the Define Orthodontic Podcast. My name is Gunny, Sodhi, one of the co-founders of Define Orthodontics. To my right is...
Dr. Kirat, Sodhi.
Awesome. That was a fun episode we did last week, the fact or fiction. I think a lot of people really enjoyed that as well. Today, though, what we wanted to talk about was the different bites. I know a lot of people are sometimes confused on, do I have a deep bite? Do I have an overbite? Do I have an open bite? What is a crossbite? Why do all this stuff kind of matter? So what I'd love to do is, and what we're going to do is we're going to have actually a graphic up. You should be able to see it. We're going to start, Dr. Sodhi, with a open bite. If you can kind of talk a little bit about the open bite and then briefly discuss kind of, why an open bite is not ideal and what we can do to kind of correct it.
Yes. So open bite is when your top teeth and the bottom teeth, they have an opening, like there's no overlap. So for a good healthy bite, we see that we do need to have at least 1 to 2 millimeters of an overlap, or what we call an overbite, between the top teeth and the bottom front teeth. And when we see, they could be like anterior open bite where the front teeth are not having an overlap, or we can have even a posterior open bite in some situations where front teeth overlap but the back teeth are open. And most of the times the cause for that is a big tongue that kind of pushes the teeth out, or lateral open bites. But open bites, they dictate something more. So I always, whenever I see an open bite patient, my first instance, the mind goes like, okay, what's keeping that bite open?
Yeah.
Because teeth do have a tendency to come closer together. They need a stop. They need a partner. They need to like bite with something together and kind of have a stop there. They just don't want to like hang in the air sort of thing. If there's something open, then usually as an adult, we see that it's usually the tongue that's keeping it open. But then it's like a very chicken and egg kind of situation. Okay, what came first? Yes. So was it always a tongue? Were they always a tongue thruster and they've been pushing the tongue between the teeth and keeping it open? Or they started as a thumb sucker or a fingers. They had put fingers in the mouth or something as a child, and that kept the teeth open. And then as they evolved, and the habit may have been gone, but the teeth need a seal. So you need to create a seal whenever you need to swallow some food and to take the water and to eat the food. So you create the seal by bringing the tongue forward to close that gap between the teeth. And now the tongue has gotten used to of that position for so many years, and now it refuses to go back. So that's the cause there. And then it's very important, again, the diagnosing aspect of it, like what is the cause? And even if we fix it, by the way, open bites are actually notorious. As an orthodontist, like they're not that hard to fix. Like you can fix open bites. The hardest part is to keeping them closed.
They're notorious to open up again.
They are notorious that they will open right back up to you. So here, especially for my open bite patients, I really partner up with my myofunctional therapist a lot. Absolutely. Right in the beginning of the treatment, before even starting the orthodontic treatment, I give them the referral to the myofunctional therapist and be like, okay, we can close this, but you will need this person to help you keep that bite close together. And then, of course, if this posterior open bite, we got to see how narrow the jaws are and all that aspect.
Awesome. That was really helpful. So that's kind of open bite. We're going to now move on to a deep bite. A lot of us, I'd say a lot of the patients that come in, it's actually what they have. And that's kind of almost when the upper arch fully covers the bottom. So if you can kind of go into that a little bit and how orthodontics can help with that as well.
So yeah, deep bite is when we have, lot of overlap happening. And most of the times in these situations, we see that the bottom teeth are either hyper extruded. So they are like really high up. So if they half open the mouth, you can see a little wave going on the lower arch. So you have a very deep curve of spee is what it's called. So the lower teeth are really higher up in the front, and then they are jamming into the roof of the mouth. And sometimes that comes with the top teeth being protruded because it's a constant wedge effect. So they kind of keep on hitting the teeth at an angle, so the top teeth kind of keep flaring out, and that's so overbite, overjet sometimes, especially in growing kids, can go together. So it's a matter of fixing it, but then it's also a matter of like what happens is, like, I usually give an example of it being like a balloon effect. If the jaws are narrow, the balloon kind of goes up and then forward, So the idea is to kind of expand, so we grow the jaws sideways, so it becomes more flatter. It becomes more, instead of the arch shape, the roof of the mouth becomes more dome shape, and that helps helps kind of contain and bring the tongue, like all of it is again, like it's a whole overall position, because what can happen is you can fix the overbite, but again, overbites also can return as an adult, because if your muscles are still programmed to be really tight, they can also keep on working. And if you've not, given them the good equilibrium, you can have the deep bite again.
Absolutely.
As an adult.
Can you talk to us a little bit about what a crossbite is? I know a lot of times this term is often confused. So I think this is a really important term in orthodontics because we diagnose it quite a bit.
Yes. Crossbites are, again, like our bite. I usually describe this as like our top jaw is supposed to overlap or kind of overhang around our top bottom teeth, like a lid on a jar. So if you ever have a lid with a jar, like whatever, so the lid is always a little bit wider as compared to the jar. It fits together really well. We know exactly which lid is for which jar, and it goes together really well, but it is always a little bit bigger to kind of fit in a better position. So that's exactly how we want our bites to be. So our top jaw needs to be a little bit more wider and overhanging on our bottom jaw. But if that lid is smaller, and just imagine that lid getting stuck on one side or maybe even both sides, and then the bottom jaw becoming a little bit more wider, that is a crossbite. So we like to correct it, because what happens, especially if we've seen this happen in growing kids, if we do have these cross bites developing, it can lead to like the kids, it's not the best feeling, because like the tooth is biting in a different position. You have a cusp to cusp relationship, and you can it's not fitting together as well. So what the kids start doing is like to avoid that hitting posture, they start moving the jaw a little bit. They don't hit in that position. And if a kid keeps on doing it for a long time, the muscles can adapt in that position. Yeah. We can see facial asymmetries happening.
The case we saw one yesterday, very similar to that. Remember, he couldn't cross it over, but then you were like, well, this is not your actual bite. Like your muscles and jaw had adjusted to that.
Yes. So cross bites are really crucial to be diagnosed as early as possible. Like that's one thing given. I think there's no controversy around this, that the moment you have any cross bite, you see it and you correct it right away.
Absolutely. Let's talk about an underbite, because I know this is something that is very visible when patients come in. This is something that is clearly bothering them. And if you can kind of go into how orthodontics is used, I know this majority of the time braces is super efficient with this, but it doesn't have to always be treated with braces or an underbite.
So underbite is basically an anterior crossbite. Yeah. So we have anterior crossbite when we have the top jaw, which is a little bit narrower as compared to the bottom, and the bottom goes ahead of the top, but that happens more anterior position, like the front, and you can see that happening. That's an underbite. Now, underbites are interesting because they could be skeletal or dental. If it's a dental only underbite, meaning the jaws itself are positioned correctly, it's just the teeth itself are not biting the correct way, that's actually easier to correct, and you should do it right away because you can prevent some damage that might happen to the teeth. But if it's a skeletal crossbite or skeletal underbite, that's pretty interesting, because again, something that needs to be diagnosed and evaluated as early as possible. Get in there. Expansion and reversible headgear is what's used to kind of mostly correct it. But you do the face mask to kind of help bring the jaw forward. So upper jaw almost stops growing because we have two plates on them. They kind of start fusing and stop growing by the age of 10. So we want to like get in there as early as possible.
There's a window.
There's a window. I mean, there are different things now we can do. Like we have different kinds of expanders to even do it if we've missed the window. So that's, but the simplest and the easiest way to fix is with that.
You're saying early intervention, is ideal, right?
Yes.
Afterward, you can still do something, but it just becomes a little bit different treatment modality at that point.
So early intervention is really important, and getting in there is very important. Getting in, correcting the cross bites and underbites and letting the jaws grow. It's more of a jaw issue, so skeletal issue. So, and because it is a skeletal issue, and sometimes even with braces or treatment, you can overgrow, like the kids can overgrow. They can get a little later growth spurt, especially for boys, or you can outgrow the treatment is the term that I usually use. And if that does happen, then sometimes we're left with not much option but to do surgery, which again is not a bad thing. Like I feel like our surgeons do a really good job, and that's one of the most commonly performed oral surgeries for is like, the underbites, because it's very uncomfortable to live with an underbite.
Yeah, absolutely.
You can't really chew, you can't really bite, you get constant cheek bitings, like it's not fun.
And don't forget, tongue positioning is never achieved ideally either. All right, last one, crowding. I think what a lot of people maybe don't know they have, I'd say, a lot of people do come in and they see the crowding for the first time. They're like, wow, because the records and photos that we take really kind of exemplify it in front of them as well,
I feel like crowding, people do notice crowding. They do have a lot of crowding, especially if they have to do a lot of crowding, they notice it. But that's one thing that people think that, okay, that's something that they can live with. Yeah. Like, I feel like that's most ignored kind of thing, because they're like, I have some crowding, I have some overlap teeth here and there, I'm just going to live with it. They don't bother me, because you're still eating, chewing fine. Your bite's not like showing much. You're kind of living with it, basically. They just kind of learn to live with it. But I feel like that's one of the most common things where as an adult you get the treatment for, because you start noticing the ill effects of it a little later. So like whenever we see kids with crowding, parents are sometimes asking, oh, what if we don't do anything? And I'm like, sure, if you don't do anything, will the child be still eating fine, living perfectly normal life? Absolutely. Is it dampening your kid's confidence? If yes, then yes, treat it right now. But if it's not, and you've got a pretty confident kid on your hand and they're not bothered by the little crowding that they have or a little excessive crowding that they have, doesn't matter. It's not by any means like something that you absolutely need to get treated like right away for. And that's why people ignore it. But then I've seen that over time, if we let that crowding kind of go, there's a consequence to it. Like one, we have to address the issue. Why is the crowding happening? Okay. And then two, that crowding may lead to like you not being able to brush and floss in that area, the periodontal health getting affected. And then you have, forces acting at an angle on the teeth and the teeth wear is happening. So that's most commonly when we see adult patients being referred by the general dentist or the periodontal specialist, they sending it over for ortho because they're like, oh yeah, that needs to be resolved because that's now impacting your teeth health.
Absolutely. Well, awesome. Thank you so much for going over the different types of bites. Perhaps some of those resonated with you. If they did, again, feel free to come on in and schedule a consult, see how we can help you, especially if you have an underbite, that you're going to be definitely feeling that. So thank you so much for joining us on this episode. Join us next week on episode 5. It's actually a really near and dear to our hearts because it's the episode where we kind of get into, why we created, founded Define Orthodontics and kind of what we stand for, the why behind it. So thank you guys so much. We'll see you guys next week. You take care.